Welcome back. It's time for Morning Rounds.
This week is National Infertility Awareness Week, showing the daily impact of infertility and the challenges people face. We are learning more this morning with Dr. Lauren Harringer with Christie Clinic. Good morning, doctor. How you doing?
I'm fine. How are you guys?
Good, good. So is infertility, first and foremost, a common problem?
Yes, about 6 to 12% of women who want to get pregnant have a difficult time getting pregnant. So it's a fair number of people that we need to assist with this.
What causes infertility?
Infertility has a lot of different causes, and not all of them are with the women. Some of them are with the male factor. There are some things that make infertility a higher risk, such as age. So it's important that you start thinking about your fertility early on and deciding what it is you want to do. Smoking, and that's one that you can control. So if you can stop smoking, that does help. Excessive alcohol doesn't mean you have to go completely without any alcohol, but when you are trying to become pregnant, we would prefer that you not be drinking alcohol very often. Weight loss is probably one of the biggest ones, or weight gain if you're severely underweight. And then the physical or emotional stresses that we put on ourselves to try to become pregnant can be very uncomfortable to a lot of people.
And doctor, what increases a woman's risk of infertility?
All those things I just mentioned, for the most part, are what increase the risk. Probably the number one factor would be the weight of a woman, because heavier people tend to have something called polycystic ovary syndrome, and that makes you not ovulate. And if you don't ovulate, it's much harder to get pregnant. On the other hand, women who are extreme athletes and have very little body fat on them have a problem also with ovulation. So trying to be as healthy and staying in the normal ranges is what's best to help you for pregnancy.
So how long should a couple try to get pregnant before seeing their provider, and what type of provider should they be seeing?
Well, we'd love to see everybody before they try getting pregnant. They don't need to start worrying about the fact that they haven't gotten pregnant until 1 year if they're under age 35. If they're over age 40, we'd really like them to be seeing us around 6 months of trying.
And are there any signs or symptoms that a woman or a couple are experiencing that maybe they might be having an issue?
The irregular periods is probably the number one sign for women that there may be difficulty getting pregnant. So if they're not having any periods, or if their periods only come once or twice a year, or on the opposite, if they have periods every month but they're so severe they're not able to function with them, those are all signs that there could be something wrong at the ovulatory part. And then pelvic inflammatory diseases, more if there's an actual history of infections.
And doctor, are there any common misconceptions about infertility that couples should be aware of?
Well, the most common probably is that it's always the woman's fault. There's also a very large male factor that it plays into this too. So it needs to be a joint evaluation. We need to be looking at both people when we're trying to figure out why the pregnancy isn't coming off.
And of course, you mentioned that a few times. What are some things that men have to worry about too?
Well, the male factor often gets evaluated by the urologist, and many times it's that they have either had some kind of infection or that they have something called a varicose in their system that needs to be surgically corrected.
And doctor, if people do have questions about this, what resources do you have there that might, point them in the right direction?
Well, certainly calling and getting an appointment with anyone here in our department would help. We can also get them referred to reproductive endocrinologists here in town. So there are lots of ways to get help here.
Doctor, thanks so much for your time this morning. We really appreciate it.
All right. Well, thank you.
Thank you.
You
have
guys
a great
have a good
Tuesday.
day.
You too. Jack has your forecast next. We'll be right back.